My name is Simon Sadinsky and I'm Deputy Executive Director of the Prince's Foundation. This Global Centre on Healthcare and Urbanisation really couldn't come at a better time, or a more important time. At the moment we're facing rapid urban growth across the globe, with urban populations expected to double by 2050 to I think about 6.5 billion people, and much of that growth happening in secondary cities in places that have the least professional resources to cope with that growth. So it's absolutely vital that we start to develop a knowledge base and understanding of the impact that rapid urbanization is going to have. And one area of particular interest is how that's going to impact on our health and well-being. The intersections between global health and urbanization are there anecdotally and are increasingly being discussed, but it's so important that we actually have an evidence base to support that, to give to practitioners, to give to people implementing urban change, to do so in a sustainable, harmonious way.
I'm Dr. Yasmin Khan and I am Senior Tutor at Kellogg College. We are delighted at Kellogg to be seeing this Global Centre for Healthcare and Urbanisation in partnership with the Prince's Foundation launch. I can't think of a more timely moment for a centre like this. I think all of us can appreciate the importance in the future, in a post-COVID world, that sustainable, healthy cities are going to have, and this backdrop of this epidemic makes this even more urgent and timely.
The forces of rapid urbanisation, climate change and natural resource depletion are so great that now is the time for different professions to combine together with a clear focus and determination to help solve these critical issues, which will impact on the lives of millions of people for generations to come.
I'm Kamal Matani. I'm a GP and an associate professor. The timing and potential impact of the Global Centre is highly relevant as we look to develop more healthy cities. As a GP, I'm aware of the growing recognition that our health is influenced by a variety of factors. Some of these may be medical, others may be social, environmental or economic. As a result, there is a need to support people by taking a more whole person-centred approach to health and well-being. Social prescribing is a way of referring or signposting people to a range of local, community-based non-clinical services. These are sometimes referred to as assets. Community assets might include green spaces, libraries, museums, and other cultural centres. And releasing the full potential of these assets will be key to ensuring social prescribing is sustainable and we live healthier lives. Such assets might already exist in urban areas. However, there is a real opportunity as we plan and develop how our urban areas evolve, and with the support of the new Global Centre, that these spaces become areas that consider the health and social opportunities of our city's evolution.
Through our work with the Prince's Foundation over the last 30 years, working in these issues in the UK and indeed internationally, we've seen firsthand the need for centres such as this, the impact that urbanisation can have and that particularly poorly planned urban development can have. So I think for us as the Prince's Foundation, this is a hugely exciting initiative and builds on the other work that we've been doing in this area.